So Nick, you had a WAVI scan that was done recently. Did you have any symptoms or anything that drove you to get a scan done?
Not in particular. I really just wanted a baseline scan.
So you hadn't been hit or struck? You hadn't had your head rattled recently?
You know, I did. I was hospitalized twice for concussions in soccer.
Was that recent?
No, in college and then afterwards. But my last concussion was probably 10 years ago.
Okay, so you're looking at old, cold kinds of clinical case work where you had injury that certainly was significant, but you don't necessarily have any symptoms now that you would really worry about, and no recent impacts or whiplashes, right?
That's correct.
Okay. So that's important, because there's a baseline of, like, say, a pristine child that's never been injured. There's a baseline of an adult that's also, say, pristine and never been injured. Then there's a baseline of an adult who has not been recently injured, but like you, has had a long ago, we would think, resolved, concussion, because
Sure.
most people's concussion resolves within a year after their concussion. So yours is 10 years, so statistically we would think there should be nothing left on you. So we would like to do a baseline like you did, in that you're heavily involved in volleyball. I know you told me that you do a lot of beach volleyball. And so if that's true, then you want to be ready just in case at any moment somebody knocks heads with you, or you run into a pole, or whatever happens where you hit your head.
Exactly.
Or worse, if you have a whiplash where your head gets whipped and you don't strike anything, but your brain rattles inside your skull, that's just as bad in many cases. So then at that moment, you'd be able to do a scan within 12 to 24 hours of the impact or of the whiplash, but not before, right? WAVI wants a little bit of a delay, about a day after the injury, and then you'd compare that scan that's done right after the injury to your baseline scan that was done prior, to have a baseline. Is that what your general plan is?
Exactly right.